Doc, all my bones are aching. Do I have osteoporosis? What is osteoporosis that it deserves a special day? This special day was first launched in 1996 by the International Osteoporosis Foundation and subsequently later was sponsored by the WHO. If you take osteoporosis, its name itself, it is self-explanatory. Osteo means bone, porosis means porous. Porous is where it is less compact. If it's less compact, it is more fragile. When it's more fragile, it can easily break with very simple minor trauma. And if you look at bones, there are two parts to the bone. The edge of the bone is called cortical bone, and the inner part of the bone is what we call cancellous bone. And in osteoporosis, the first thing that you notice is changes in the cancellous bone where they become more porous. More porous means there are more empty spaces in there. 1 in 3 women above 50 years old, which means 30% of women above 50 years old has got the risk, has osteoporosis. A bit less in men, 1 in 5, about 20%. Now, it is estimated that out of this 30% of women above 50 who's got osteoporosis, 40% of them will develop a fracture related to osteoporosis. And there are 3 sites that fractures related to osteoporosis can occur. Then the wrist, which is the distal end of radius, the spine, or the vertebra, or the hip, or the fracture neck of femur. And of course, the most significant, the most debilitating fractures are the spine and the hips, because not only they are burden to the patients, they are burden to their family and relatives. To give you some form of comparison, 1 in 9 women has got the risk of breast cancer, but 1 in 6 women has got the risk of fracturing their hip in their lifetime. Now, to understand a little bit of osteoporosis, let's look a bit of a biology of the bone. The bone is a living tissue. It's got its own blood vessels. It's made up of living cells which help them to grow and repair themselves. Now, a bit of trivia facts. Do you know that you have 206 separate pieces of bones in the body of an adult human being? Men and women have got equal numbers of bones. And you don't believe the story of that we men has got less of 1 rib, as the old stories go. Now, the major functions of bones is that 1, the bone gives you structure. Without bone, you'll be just a blob of tissues, like jellyfish. Bone also provides some protection to vital organs, especially like your skull, which protects the brain, your rib cage, which protects your heart and your lungs. The bone contains bone marrow, which, as you know, produces blood cells. And the bone is also a storage for minerals, especially calcium. To simplify the biology of bones in relation to osteoporosis, basically bone consists of just a base of protein which contains bone-making cells called osteoblasts and bone resorption cells or bone that remove, the cells that remove bones, which is called osteoclasts, that works together, and the amount of minerals or calcium that is deposited in the bones that will determine how strong or how hard that bone is. Ideally, we would like to have that osteoblast, the bone-making cells, and osteoclasts, the bone-removing cells, to work exactly the same rate, so that your bone will be just as strong from day one till you die. But life is not that simple. The peak bone mass of a person, which means the strongest time or the most compact the bone is in a person, is when he or she is in early 20s. And after that, the bone gets more resorbed and become less and less strong. As you expect, as you are growing up in a child, more bone are being produced. And when you reach young adulthood, that's when you reach your peak bone mass. Then the bone starts to get less and less. If you develop your bone strong enough, maybe you delay the decline of the bone strength as you grow older. Many hormones are involved in influencing these processes, and the most notable one is estrogen. That is the reason why when a woman reaches menopause, when the estrogen levels declines, she gets more risk of getting osteoporosis. The other hormones are parathyroid hormones, and to some extent the male sex hormones, the testosterones. You may ask me, why then not everyone develop osteoporosis at the same time? Can we prevent it? And what are the risks that you can't change? Your age. As you grow older, you got a high risk of osteoporosis. If you're female, you're more prone to osteoporosis compared to men. If you've got family history of osteoporosis, also you've got a higher risk of osteoporosis. Race play a part. Asians are more susceptible to osteoporosis than African blacks. Now, the risk that is under your control that you can change are smoking. Smoking increases risk of osteoporosis. Alcohol drinking. Low body mass index, which means if you're very thin, you got high risk of osteoporosis. Poor nutrition, vitamin D deficiency, eating disorders, all this can have high risk of osteoporosis. And one of the most important one as well is insufficient exercises. If you do not exercise, you're more prone to osteoporosis. So prevention starts from childhood. So you must achieve this highest possible peak bone mass. So by eating bone healthy diet, good proteins, and plenty of exercises. As an adult, you can slow down this rate by having healthy lifestyle with not smoking, not drinking alcohol, and stay active with exercises. For older people, in addition of the above, you must take precautions of not having falls at home. There are tests that we can do, especially we can measure your bone mineral index. There are various ways of measuring it, and the one that's reliable and more acceptable is what we call DEXA machine, DXA. It stands for Dual Energy X-ray Absorptiometry Scan. What it does, we used low dosage of X-rays and measure your bone mineral density and compare it with normal bones and of your own age and of your own sex and your own race. What they do is that if your measurement is less than 2.5 standard deviation from this normal people, then it's confirmed that you got osteoporosis. Who should go for these scans? Well, if you got higher risk factors, then you should go for the test. Now, are there treatment for osteoporosis? Yeah, there are many drug therapies that's available in the market. Apart from your hormone replacement therapy in early menopausal women, some of these therapies involve tablets which you can take every day, or you can take once a week, or there are nasal sprays, there are injections, and various other drug therapy. Of course, treatment is not 100%. Studies have been shown some of these treatment is they protect 40% of those osteoporotic patients and prevent them from getting fractures as compared to osteoporotic patients that do not receive any treatment. Which treatment modalities which is suitable for you, your doctor will discuss it with you. In addition to the drug therapy, of course, you need your calcium and vitamin D supplements, and vitamin D is manufactured in your skin. And studies have been shown in a young adult, all you need is 15 minutes of sunlight per day. So lead a healthy lifestyle with good exercise and with the treatment, you should be protected.